Hi, Dr. Corey here, and today we're going to talk to you about Thyroid Recovery Success Secret number 12. We're going to talk to you about your brain's function. Your brain function is extremely important in treating your thyroid, as I've mentioned in previous success secrets that you've seen already. The brain controls virtually every bodily function that you enjoy as a human being. Your pituitary gland drives the thyroid gland and releases thyroid stimulated hormone, or TSH. The part of your brain called the hypothalamus drives the pituitary gland. You see, all of this works together. Your body is not made up of a bunch of parts. Now, our brain needs two things to survive. Two things that I mentioned to you is fuel and activation. Now, fuel is oxygen, which is why we exercise with oxygen therapy, or what we call EWAT, in our office. And glucose, we've addressed in the glucose end of the equation with the previous success secret. You probably just watched that on your last email that we sent to you. So let's address the importance of oxygen. As you age, your ability to utilize oxygen decreases 1% per year after the age of 25. 1% per year after the age of 25, your ability to process oxygen decreases. So if you're 50 years old, you've lost 25% of your body's ability to utilize oxygen and for it to distribute oxygen throughout the red blood cells and so forth. It's called oxidative phosphorylation, which is a big fancy $3 word for meaning that you're not using oxygen as well as you did when you were younger. So again, this is why we do exercise with oxygen therapy in our office. And secondly, serotonin plays a large major factor in thyroid function as well. There's a place in your brain called the hypothalamus, and then there's something called the periventricular nucleus. I know these are big fancy medical words, but it's critical that you know this stuff if you're suffering from thyroid symptoms. Now, the hypothalamic periventricular system, or nucleus, is acted upon by serotonin in the central nervous system. And what it will do is it'll make you have low thyroid. So if we have an effect and the serotonin is acted on within the central nervous system, that'll actually make your thyroid low. So the TSH goes down as a consequence. Taking thyroid hormones for these problems is not going to do anything for you. It'll most likely make your symptoms worse. So don't get me wrong, I'm not telling you not to take your medication. That's between you and your medical doctor who prescribed them. That's also called practicing medicine without license, which I don't do. We have a thyroid recovery program, we do it naturally, we don't use medications, and we talk to you about function, and we want to make sure that we get the function up so that you don't have a medical condition to even worry about. We want everything to be completely clear. But be aware of what's happening is what I'm saying. So when you're taking the hormones, if you are oxygen deprived and your TSH is dropping as a result of oxygen deprivation, then you're going to have a problem with the thyroid. So it's just one big cycle of a circle that keeps going around and around if we don't take care of the core causes of the problem. Now, what I am saying is be aware of what's happening in your body, because once you start taking the medication and asking the doctors, well, why am I taking this medication? They're going to think that you're crazy when you look at them and you start asking them. They're going to think you have a psychosomatic problem. They're going to think that it's all in your head. And the only thing you need to do at that point, according to them, in many cases, as I've seen patients come in, is you put you on antidepressants. They think, hey, this person's not thinking right. So you ask them about your thyroid medication, they think you're crazy, they put you on antidepressants. So the cycle goes on and on. Okay. So what I want you to talk about is, what I want to talk about at this point is I want to talk about the biggest influence on your serotonin, and that's your blood sugar. That's why we just covered that and addressed the glucose levels in Thyroid Success Secret number 11. So it's at a vitally important time that your hypoglycemia or your insulin resistant or diabetes is maintained and that blood sugar level is balanced out. Now, why is this so important? Is because I want you to make sure that your blood sugar level is corrected so that you're eating proper meals, you're not skipping meals. I want you to quit eating any junk food. Every time you're eating junk food, you're literally eating away at your thyroid, and you're making your problem worse and worse. So food has a big impact on how thyroid hormones are regulated, how they're transferred from being active to inactive, or inactive to active, and how they get into a cell. So by consuming these poor junk food filled diets, you're actually increasing your thyroid symptoms, and you're feeling tired or sluggish, or you're having an inability to lose weight, having cold hands or feet, or insomnia. You'll gain weight more easily, you'll have difficult or infrequent bowel movements, you'll be depressed, you'll have a lack of motivation. I mean, the list goes on and on and on. So we want to make sure that we get to the core cause of the problem. Now, you have all these symptoms and yet your lab tests are quote or unquote normal in the eyes of your medical doctor. How are you getting a proper evaluation if you keep going through that same cycle and you keep having the symptoms and you increase your TSH, decrease your TSH through your medications, but you never get to the core cause of the problem? That's what we're here for. If we want to answer those questions, we want to make sure that we're thorough in our evaluation. So remember, those labs need to be within optimal or functional ranges. You have to have the proper testing done. Don't suffer another minute, another day, or another year. Call our office for your evaluation, your consultation, examination, and your review of your previous blood work. You can contact me, Dr. Michael Corey, at 714-730-5833. We look forward to helping you get your life back and overcome your thyroid dilemma.